Hey everyone, I'm your host Anthony. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching. Hello everyone and welcome to our live class. We're so excited to have you here today and we're looking forward to a really great lecture. My name is Anthony and I'll be your host for today. I'm joined on the line once again by Dr. Brandy Zachary, who will be conducting most of the presentation today. And I'm going to pass it off to her momentarily to kick off today's topic of GI map versus GI effects, a stool test showdown. So I think we're all really excited about this one, and I'm sure we are going to learn a lot. Now, before we begin, I'd just like to go over a couple housekeeping items. I've muted everyone by default. And number two, if you have any questions during the course of this live class, please submit them into the chat panel. The questions will come to me as the host, and I'll be conducting a live Q&A with Dr. Zachary at the end of today's presentation. And lastly, we'll be hosting a live demo at the end of today's live class with our head of practitioner partnerships, Adrian Martinez. So for those of you who are new to Rupa Health, please feel free to stick around if you'd like to learn more about how we can help you optimize your practice. For those of you who already use this, thank you very much. And if you need to get back to your practice or your day, feel free to hop off. So with that being said, welcome back, Dr. Zachary, and I'd like to hand it off to you now to begin the presentation.
Great. Thank you so much, Dr. Kapaste. It's my pleasure to be here with you and everyone from Rupa. So today is a fun topic, GI map versus GI effects. How do you use these stool tests? When do you use them? And a little bit more about, which one to reach for which type of patient that comes into your office. So let's dive in. First of all, just a little bit of standard disclaimer. This is an educational class. From my perspective, always make sure you do your own research. And then here's the topics that we're going to cover today, just so you know to hang in there until the end. We have a lot to go through. Plus, I'm going to be showing you both of the sample reports for each stool test in detail. Very briefly, before we dive in, just a little bit about me if we haven't met. My name is Dr. Zachary, or Dr. Z. I came to functional medicine really as a patient first. I had a completely different career and got quite sick. I was declared permanently disabled, in bed 22 hours a day, and getting a medical treatment in the hospital every 3 weeks that cost over $700,000 a year, and was told that was just going to be the rest of my life. So big fan of functional medicine, some of the practitioners I saw, reactivating my own license, having to do my own research, and return to the land of the living. And that's how I led to creating Body Love Cafe, which is our clinic branch. My true passion is teaching. I love to do it. So I teach all the time, and I work with a lot of practitioners actually on 5 continents around the world and every type of license. So lots of fun. So that's basically me. If you have any other questions, let me know. But otherwise, let's just dive into what we're doing today. So the first thing is, why are we going to do a stool test? And I just grabbed some quotes from each of the labs. Why are they saying that you want to do a stool test? We know clinically and in our practice how much the gut impacts overall health, and research continues to expand on that. It doesn't just involve digestive health, but also immune health, metabolic, neuroendocrine function, the brain-gut connection. So I wanted to share the perspective from each lab, whether you're team GI map or team GI effects, both good information from each of the labs, why a stool test is valuable. I know in our clinic, not every person gets a stool test, but almost. That's how valuable it is. So we'll talk more about some of the criteria to consider, especially when you're trying to decide, should I do a stool test, or am I going to do a blood test, or am I going to do some other metabolite or some other method of measurement? So stool tests, very, very valuable. So from my perspective, I just think of a stool test as a peek inside. So even though we're measuring stool, and this is largely, a concentration of what's being formed in the colon, we know it's one long tube. We need to educate our patients about it. And there's things that you can actually see, like there's some bacteria that may be more commonly found in the oral cavity, and you're seeing it show up in high amounts in a stool test. We need to look at that. There's things that will show up in a stool test that indicate something that might be going on in the small intestine. So it reflects northward, even though it's a southward test. And I like looking under the hood, so to speak. Here's some of the digestive disorders that our patients are dealing with and experiencing. Some more chronic illnesses, lifestyle-based, very common, some more serious that may warrant a referral or a co-management, but there's a lot of clues in stool tests. And the type of stool tests we're talking about here with GI map and GI effects is rarely or never in a hospital setting. So not entirely impossible, but just not as common. So those of you practicing functional medicine and nutrition in your clinics, you're really offering something that your patients can't get elsewhere. And the amount of information and the valuable insight just really so far is irreplaceable at this point. So big fan of it myself. Here's some indications for ordering. There's a lot more, but certainly any type of digestive complaint could warrant ordering a stool test. But also it's more than that. You need to think, what does the gut impact? Just about everything, but start getting outside of the gut to the rest of the body. Do they have acne? Do they have eczema? Are they getting rashes? Are they having anxiety, low mood, hormone issues, food sensitivities? Are they dealing with a lot of pain? So all of these can provide helpful insight. Immunodeficiencies, autoimmune disorders, so low or hyperimmune state. Okay, so this is the question you were showing up for, right? So which one is best? This is our stool test showdown. So Team GI Map versus Team GI Effects. Let's dive in. All right, so the first criteria you need to do to evaluate these tests is which one are you going to order and use? And that may sound simplistic, but you know how important it is. Remember when you're talking to your patients and you're trying to talk to them about a meal plan or exercise, you could give them the best thing ever, but if they won't do it, it doesn't matter. So in the long run, which test, which protocol, which report are you comfortable with? What are you going to order and what are you going to use? That's going to be your number one answer because you need the data. So whatever you're willing to use, that's a notch on Team GI Map or Team GI Effects for you. And information is only helpful if you know how to use it. So part of what we're going to cover today is how to have resources with both of these labs and how to correctly read them. So I'm going to demo how to read each lab here towards the end. But criteria number one, which one are you going to use? And sometimes that's your personal preference. Sometimes it's access. Sometimes it might be license dependent or location dependent. So find out what's available for you. Okay, criteria number two, is that information helpful? So again, thing to get the report, but then do you know how to use it? And do you understand some of the differences between the tests? And when are you looking for one method versus another? So for Team GI Map, the testing method is what's called qPCR, quantitative PCR, or also known as real-time PCR, which is a very advanced and precise methodology. Lots of great research backing that up, and you can look into some of the validity for that. For Team GI Effects, they use three methods on their test. They use a traditional PCR, for some of their markers. They culture some out and they do microscopy. And so they're looking at it through a microscope. And then I listed the features of each of the tests. There's clearly some overlap, but there are some differences. So the way I listed it here, so you can see it, and I'm sure Rupa will make the recording available later, is basically how that lab has it organized. And I'm going to show you the report, and we'll talk about where to get a sample report so you're really familiar with it. I wanted to give you just a little bit of information on PCR versus qPCR, because you might wonder, well, what is the difference? And there's a lot of key differences as you go along, but the bottom line is the difference between seeing if something is present or not and having sort of a targeted range versus actually being able to say, this is how much of this is present. And that may or may not be important to you in practice. So I wanted you to know the difference when you're pulling one kit or another for that patient who's in front of you. And if you just need a targeted rate, or if you need an exact quantitative rate, when you're using it, do you know how to use it? So I will show that on those labs. Okay, criteria number 3, ease of ordering, cost, and time. This matters to practitioners because, we're not just in the business of taking care of our patients, but we also have to run a business. And some of you are solo providers where you're doing everything. You have that hat on that says I answer the phone and the email, and then the hat on that says I do billing and account receivable and accounts payable, and then the hat that says I'm the doctor practitioner, and the hat that says I have to market and bring new people in, right? That's actually part of what makes Rupa Health so great. I'm a big fan. I've been using them for a while now. My office always likes to say, you can't drop Rupa Health or we quit. That was their quote, not mine. And when your staff says that, you better listen. I always consider Rupa Health like a free staff member, so it's great. But they certainly help make it easier. So I listed some approximate prices here. Now, keep in mind, when you look at these prices, they can be different for you based on location, availability, insurance billing, etc. So make sure you actually check with Rupa Health and the lab for exact prices. But one of the things that can be a little bit confusing is you're trying to compare apples to apples, and they're both stool tests. Both provide excellent information, but it's hard to do a little bit of an apple to apple comparison. So GI map largely is one complete test with an add-on zonulin. So I gave the price. When you add on zonulin, that's the total price, not addition. It just takes it from its base up to that price. And then I gave you a turnaround time from the lab once they receive the test. Of course, there can always be lab delays. We've all dealt with that. We just let our patients know the reports, if they're delayed, they do come in. And then I did list under Team GI Map some of the things that are missing on the GI Map that you'll see on GI Effects. And I did the same thing for GI Effects. So GI Effects, you see a base price. They're a little bit more of an a la carte. So if you like to customize a bit more, that might be appealing for you. They can break their test up in some smaller pieces, so you can order a section of it, or you get their main GI effects, and then you may add on. For example, I showed the base price, and then I added on H. pylori, E. coli, C. diff, Campylobacter. It added up to that price. If we add on zonulin again, we get that price you see there, and then listed their turnaround time. Part of the additional price is because of the culture and the microscopy. So that's for reference, but make sure you do check the exact numbers. But this could be something that is not only relevant for when you make a choice for the lab for your practice, maybe you have a favorite you lean towards, but also patient by patient, depending on the situation, you may choose one or the other for that specific patient. The other thing I'll mention just real quick while we're here is for those of you that bill insurance. In our clinic, we don't do that. We provide super bills. But if you bill insurance, that's a little bit of a different protocol. The prices can be a little bit different. Some labs require that you pay half up front or submit a different form, or you do it after the effect. I can tell you that in my experience with GI Map, if they were going to bill insurance, they did not charge extra if insurance didn't cover it. So that's not always the case with labs. Okay, criteria number 4, practitioner support. Now, this is also very important and might not be something that you're thinking of. Oh, when I'm choosing a stool test, why am I thinking about that? Well, these stool tests are both great in that they have a ton of markers. So we're headed there, right? And some of these markers you're going to memorize because you're going to see them over and over again. They're highly relevant to the type of holistic health you're practicing in your office or your technique. And you just become very familiar with it. And other markers you're not going to be as familiar with. You may see them only out of range here and there, or it's just the amount of markers and all the Latin names. You don't have to memorize it all. So don't feel like you have to wait to utilize these labs until you have it memorized. Not at all. Both labs offer a lot of practitioner support. And what you really need to know how to do is how to find the answer and then understand it. So in that way, you become very much a translator for your patients, which is a very valuable service. You make sense of this report for them. I know some practitioners, if they didn't know something, they felt like they had to leave the room and hide it and go, excuse me, I have to go deal with something at the front desk and then go look it up. We were never like that, whether it was in person or virtual practice. If we need to look something up, we did it right there and just talked through it with the patient. No one's expected to remember everything. It's not realistic, but can you find it and can you explain it? That's what your patients want you to know. So both Team GI Map and Team GIFX, the lab companies offer practitioner consults. That means that when you get a report done, especially for those of you that this is new, you're just starting, I'm going to encourage you just dive in, order it. In fact, I think you should start with yourself, maybe your family, your friends, start ordering it for the patients. The more you see it, the more comfortable you'll be. But you can talk to that lab company and schedule a 30-minute one-on-one consult and go over that lab. So that can be very helpful. So both offer that. They both have lab interpretive guides. Now, why does that matter? I'm going to show you some pictures of these. The lab interpretive guides are going to be your best friends. You're going to love those. And in our practice, we actually share those with patients. We do that for a number of reasons. You don't have to, but that's what we do. We want them to see the information. We want them to see the validity behind the test. We want them to know where to find more answers. Some patients say, just tell it to me really basic and simple. I don't want too much information. Fine, let's give a simple lay answer and then what to do. Other patients, we have a lot of medical professionals who actually come to our clinic as patients. A lot of them are very well informed, or even they're just the general public, but nutrition is their side hobby and they're always reading things and, PubMed articles over breakfast and coffee. So they want more information. Great. You can provide it for them. And then you don't have to spend the paid visit time going over every single thing. You can focus on the key points that have to do with your plan, but they know where more information is. And sometimes I'll even say, hey, look at page 8. That's how specific we'll get. So each of them have a lab interpretive guide. I gave you the names of it because sometimes it can be a little confusing. The GI map tends to be one big guide with just about everything in together. GIFX, it's broken up a little bit more. So the guide is shorter, about 12 pages, but then when you look, there's another one that's longer, but it's called Stool Testing Combo Support Guide. So you need to know what to look for. And then they also have some grids that regardless of which stool test you use, grids from both of these lab companies can be incredibly helpful. So as you get more and more into gut health, it's such an exciting field and you're going to geek out over these markers and new research. So these labs are a good resource for information. A white paper A white paper is a term used when someone describes, why they did something and how behind it. A little bit more about the mechanism. So they each have a white paper with references. So I put some of that information in. The GI effects white paper has a different name. GI map white paper, very easy to pull up. All of these things you can find on the lab website. Rupa Health has links to many of these things. So Rupa Health is an amazing resource. So education is everywhere. Methodology guide, that's very helpful. That one from Team GI Map, no matter where you land and which stool test you use, that's a helpful one because it actually has 8 pages on all the different methods of stool testing, not just specific to GI Map, but what other companies use. So I think you would find that very helpful. So consider giving that a read and checking that out. They both have clinician training videos. And then what does their report look like? You're going to see it here in a minute. Team GI Map, it's more text-based, divided in clear sections, and the colors are, typically the flags, the high and low, and then you're going to get true quantitative numbers. So we'll show that. The GIFX is more of a visual format with charts and graphs and a lot of color. They use a lot of their own algorithms, so I'm going to explain that a bit more. So depending on what works best for you or what you feel will be best for that specific patient might dictate your choice. All right, let me show you a few of these samples. So here's from Team GI Map. So the picture on the lower left is a little bit of the interpretive guide. So you can, a little trick for these, by the way, when you pull them up, they're always a PDF. You can look at them online, in the cloud, or you can download them on your computer. And then when they're extensive, 40 pages, 50 pages, hit Control F and search for what you're looking for. So if there's a specific marker out of range, type it in, boom, you're going to jump right to it. And we teach our patients to do the same thing. So this shows you it's cut off, just because I wanted to give you an idea of a couple different pages. These aren't in order, but the interpretive guide, a little bit about C. diff. And then in the middle, that's actually page 8 of the GI Map interpretive guide. That's a really helpful grid. It's the 5R protocol, which I'm sure you're familiar with. It's used a lot in functional medicine and holistic care: remove, replace, reinoculate, repair, rebalance. And it talks about some of the different phases and lists some ingredients, which is nice, because then you can go look for those ingredients in your favorite supplement line or look for them in foods or whatever tools you're using. On the right is H. pylori. GI Map does include H. pylori standard in their test, which I like, and it has virulence factors. And we'll talk a little bit more about those virulence factors, but I wanted to show you what that grid looked like. And that's in their GI Map interpretive guide. There's more in their white paper. Okay, a little bit more from Team GI Map. Here's some of the grids from their interpretive guide. So you can look up a specific bacteria, whether it's commensal or opportunistic, and get some information about it, whether there's an autoimmune association. So some of that bacteria, it's still an opportunistic bacteria. And opportunistic, we have beneficial bacteria, we have pathogens, and opportunistic may or may not be present. And when it's present, it may not be a problem, but it's opportunistic in the sense that when someone has dysbiosis, when their microbiome gets out of balance, when they're at a disadvantage, maybe there was a round of antibiotics or some other type of protocol, it may be even an elemental diet, something that mimics antibiotics, or a heavy series of antimicrobials. Anyway, these opportunistic bacteria can then take advantage of it. They wait for the opportunity and they look to overgrow. So opportunistic bacteria is something really in the realm of functional medicine, working with our patients. A lot of times it's just not on the radar of traditional medicine at this point, even though there's really good research demonstrating the negative impacts of opportunistic bacteria when overgrown, and more research that's looking at the connection of, oh, we see Pseudomonas and we see strep and we see low elastase. What does that combination mean? Things like that. So great research coming out and already existing, sort of putting these pieces together. But these things that are divided into an autoimmune section, the reason it's still opportunistic bacteria, but the reason it's separated out is because we have additional research and experience that those bacteria, when they're in abundance and they're able to cross, a lot of them are gram-negative bacteria, so they have the the endotoxin LPS, lipopolysaccharides. When they're able to cross that gut barrier and get into the bloodstream, I always call them little pissers. Those gram-negative ones, I just think they're like gremlins. They cause more trouble. Anyway, we have additional research that shows that bacteria can initiate and sustain the autoimmune process. So that's why it's divided in a separate section on this lab guide and this lab report. Okay, last sample of lab guides and support for Team GI Map. There's more out there, obviously, but I just want to give you a little snapshot. This grid on the left is great for calprotectin. We'll talk a little bit more about calprotectin, but if you're not familiar with that, we're looking at neutrophil infusion and activation of the immune system and an inflammation marker for the colon. Calprotectin is one of the most studied markers for inflammation worldwide. If someone is 49 and below, it's statistically impossible for them to have inflammatory bowel disease, ulcerative colitis, Crohn's. So when you start getting above that, you can see this grid walks you through it, 50 to about 150. It could just be inflammation from some overgrown opportunistic bacteria, or there could be a bigger issue. We might need to do some more testing. And then as you get higher up, it certainly becomes more serious. A colonoscopy may be warranted. And if you see high calprotectin and blood in the stool, certainly in our office, we refer for a colonoscopy immediately and have actually been able to refer out and catch cancer and have people's lives saved. So don't underestimate the power of these stool tests. It's really amazing what you can see early on. There's a grid here from GI Map that talks a little bit about the different testing mechanisms that you want to look at. And then Epstein-Barr virus, it will only show in the stool test if it's an active infection, but it's one of the few labs that has that. So I put a little bit of information in there, and there's certainly more in the guides. Okay, so let's look at some of the lab support and guides for Team GI Map. So on the left, you're going to see sort of a stool profile overview that talks a little bit about those markers. That's a shorter piece, something you may or may not want to share with patients as for why you're saying, hey, I want this test. The one in the middle with a lot of orange, that's a longer document. You can look at it on their website, and that helps you really. It's not something I would share with the patient, but that helps you decide, do I want this GI effects, or do I want a smaller test, or do I want some add-ons? So it just helps show you what's included with their markers. And then on the right is an example of their clinical guide, where you see a little snippet of the lab report, and they were talking about elastase, and then it tells you a bit about elastase. Again, that's a really easy one. You're going to see that a few times. You're going to learn that. You're going to have it memorized, but you have this information for all the markers. So that's the important piece to know. Okay, here's a little bit more, some samples. It looks small just because I'm showing it to you on the screen, but these are, 8.5 by 11 sheets, and you can zoom in and see it better because it is small writing. But there's a parasite grid, and this is Team GI effects. There's a pathological bacteria and yeast. There's a commensal bacteria. So, some of those tools are helpful regardless of which stool test you use. So you might want to even just collect for yourself like a folder in Drive or whatever you use for cloud storing or on your desktop, and just pull some of these great resources from each of these labs, and just have like a stool test resource library for yourself. And of course, making sure you understand how to use it, because a guide is only helpful if you understand how to read it. But in this example, you're going to see the name, of the organism, a brief description, the epidemiology and transmission, if it's pathological, and some of the symptoms. And then depending on which grid you're looking at, it might say the significance if it's high or the significance if it's low. So those are the things we always want to know clinically. Here's a few more lab guides and support from Team GIFX. So on the left, this looks like a page from their report, and you're going to see the report in just a minute here, but this is from their guide. So they're walking you through how to read their lab guide, and both labs do that. So here's a screenshot of theirs. As you can see, it tends to be a little bit more of a visual representation. So some people like that works better for their brain and learning. Some people are distracted by it. So you have to pick what's going to work for you. And also what's going to allow you to find answers quickly in the moment, because of course you're going to prep for visits, but if you've already been doing this for a while, the unexpected pops up. There's a question you didn't anticipate, or a patient shows up and they brought a lab to you and they didn't bring it in advance, right? You're right in the middle of a visit and it's, oh, by the way, I have a GIFX. Okay, great. Pop it up. Let's look at it. I have a GI map. Great. Pop it up. Let's look at it. So you need to be able to find your answers in the moment. Okay, a little bit. I gave meat, veggies, and fiber because that marker is only on Team GIFX. So I wanted to just show you a little bit about that. We'll talk a little bit more about that significance. Okay, so that is all criteria number 4, lab guides and support, and getting familiar and comfortable with it. Okay, criteria number 5, Team GI map versus Team GIFX. How do you read the report? You need to know how to read the report, right? So I'm going to cover some quick key markers to look for. Now, I'm not going to do the test in detail because I could take just one of these labs and we could spend an hour just on one, right? And I know Rupa Health has also provided some of that information already. So go back and watch those educational videos. So I'm just going to, show you the report and show you some key things. But there's a lot to go over. In fact, with patients, I will tell you, when we do what we call our report of findings visit, which is typically where we're going over stool tests, we could easily spend an hour in that visit with the patient with one stool test. If they start bringing in other tests and they have hormone tests and they have blood tests, we might even need more time. So that's how detailed and how much information a quality stool test can bring you for a patient's health. And although that's not really what we're talking about in this class per se, there's markers on, let's say you use a Dutch hormone test. There's markers on there that interplay what you're going to see on your stool test. Or let's say you get some allergy testing done or some food sensitivity testing, or you do a leaky gut barrier test. Being able to connect these labs is just wonderful. I love doing that. Okay, so I'm going to go through these quickly, and then in red, I'll say a few like pro, con, yay, nay, items that are present or missing, things for you to consider. Again, there's benefits to both of these tests, so it's not like it's an apple-to-apple comparison, so you really need to understand the difference so you know what to choose when. All right, so here's an example from Team GI Map. The first page of the report jumps right in, starting with pathogens. So page number 1, you're getting data. Now, Team GIFX looks different. We'll talk about some of the pros and cons of this. The first 3 pages, and I'm going to show you those first 3 pages in a minute here, but the first 3 pages are highly visual. They redid their report not too long ago. Maybe a year and a half ago. I can't remember the exact date. I just remember when I started seeing it look different. But their goal was to try to make it easier to read. It heavily relies on these visual graphics. So if you're a visual person, you might like that. Now, keep in mind, a lot of these are algorithms based on what that lab sees. So that's a different criteria than outside research, and that's a different criteria than what you may be seeing. Also, there's pros and cons to this. You might like it because it does some of the thinking for you, but it can also take longer because you're going to have to explain this to the patient. So, it's up to you whether that's a bonus or a distractor, right? Okay, so let's go through GI map. So Team GI map here, these are quantitative pathogens. Now, why does that matter? So a lot of times if you order something through like a hospital setting, you're just going to get a positive or a negative, or even other stool tests, you might just get a positive or a negative. And that means it's going to stay negative until it hits a certain threshold. This is one of the things I like about quantitative PCR tests or real-time PCR testing, is that, is there any, like, we're looking for genetic material, DNA genetic material for that pathogen, that virus. Is there any there? I want to know, because that can have significance, even if it's not in a high enough value to get a red flag. So you can see E. coli, for example, showed up here, but it wasn't high enough to get the red flag. The C. diff toxins were. But that can have an impact, especially when you read the report as a whole, you consider your other lab data, and you consider that patient in front of you. Because labs are amazing and wonderful, but they are also a piece of information, a moment in time, and we also always have to tie that back into the person in front of us. Campylobacter is included. That's a common source of foodborne illness in the US. C. diff is included. That doesn't necessarily mean they have an active infection. If they have the sign and symptoms, they could, but they could also be a carrier of the toxins. That information can be valuable if you're a prescriber. You might be more judicious with antibiotic use, because a lot of patients, particularly the elderly, if they carry these toxins, particularly in high amounts, and then they have a round of antibiotics, they are more susceptible to getting an actual C. diff infection. If you don't prescribe and you use elemental diet for SIBO protocols, same concern. So for example, I had an elderly patient in their 80s with tough SIBO, wanted to do elemental diet, had a history of loose stools. I refused to recommend elemental diet until they had done this test and I saw their C. diff toxins. So that was just how I used it. E. coli is included. It's an add-on for Team GIFX. E. coli is, very, very common to find E. coli in the environment. And E. coli is a culprit in women who have recurrent UTI infections. And when you just sort of think of the anatomy, the female anatomy, and how easily some of this bacteria can get in that urethra, just short urethra to the bladder. Anyway, it's a marker I like to see. So that is page 1. Page 2, you're looking at H. pylori, again, also included standard for Team GI map. I like that. I like to see H. pylori. So if I was going to use GIFX, I would add it on. It's an additional cost, but I want to see it with my stool testing for a variety of reasons. I also like the quantitative one because I want to see if it's there, not just high. And a lot of times it's only going to get a flag, particularly in a hospital test, if it hits a certain threshold. But I want to see if it's there at all. It tells me something about the digestive health for the patient. I'm looking at the connection between what they eat, their ability to digest, what's happening in the small intestines. And then if it is high, I like to see virulent factors. So H. pylori is certainly the culprit behind ulcers, and they may or may not have a stomach ulcer. Now, about 2% or less of those cases can become stomach cancer. It's more of a concern if some of these virulent factors come up, and you can look in those resource guides I was showing you and see the significance of each specific virulence factor. And again, that doesn't mean that they have cancer or they're going to absolutely get it, but it shows a greater genetic propensity. So it might be something to be more aware of. It might impact your protocols with the patient. It might impact their lifestyle. And then you can see the commensal bacteria. Now you can look up each one and it will tell you the significance of it being low or being high. Is it low because there's too little fiber in the diet, low digestive capacity, a history of constipation? That's common. If it's high, is it because there's dysbiosis, things are getting overgrown? If Clostridia gets high, it can interfere with the conversion of dopamine to norepinephrine and epinephrine. So now we're getting into some of our maybe organic acid testing and some of our mood issues and adrenal health. So really good stool tests tie in with all of your other tests. All right, this is page 3. Again, quantitative. I like it. I like to see the exact numbers, especially for retesting, going up, going down, staying the same. They have a clear division of opportunistic bacteria and those potential autoimmune triggers I was telling you about. For me, if I know as a clinician that they have leaky gut, some type of barrier issue, I like doing a blood test with zonulin, DAO, histamine, LPS. I like to see that. I love pairing that with a stool test. You know, what's going on in the stool, what's going on in the blood. I love seeing that combination. Both labs, GI-FX and GI-MAP, you can add zonulin onto the test. There's an additional fee, not too much, both around similar costs. Zonulin can be helpful, but it's sort of, sometimes it's a weak, unreliable marker for leaky gut. So if it's there, it helps. Zonulin's a protein. It helps control the junctions along the gut barrier. But there's other markers that can also give you a sign of barrier health. So helpful, but not an end-all be-all. Some of the markers that are included on this particular test: Pseudomonas, Proteus, Citrobacter, Klebsiella, Strep. Some of them are not on GI-FX, or if they are, they're via culture or not, and not PCR. So you need to understand the differences there. Some of these, like Proteus, see how there's Proteus, and you've got the general species and then the Proteus M. So that, I don't know if that's on your radar or not, but that specific one, these are nasty, like gram-negative bacteria. That particular one has a flagella. It almost goes in like this bullseye target formation. It can make a very serious, aggressive UTI infection. In fact, if a patient has had a catheter, so typically a hospital or sometimes an outpatient setting, over 50% of the UTIs that result from a catheter is this specific type of bacteria. And understanding the female anatomy, if I see Proteus elevated, I actually, as a clinician, recommend that the patient get a urinalysis that will reflex out for microscopic and culture examination, because women can have a UTI and be unaware of it. And if it's there, we want to know, and this one can be serious. And then there's multiple yeast markers, and you can do the research for yourself, but yeast and parasites and many of these markers, quantitative PCR is the most sensitive test for it. One thing I wanted to mention that's sort of interesting, regardless of which test you use, is there's some new information coming out that when you see Pseudomonas particularly elevated, even in a stool test, it's likely that it's in the small intestines. It's likely that there's low stomach acid, low as in abundance, or low as in not acidic enough. So actually high pH instead of low pH. So let me just make sure I've, correct nomenclature there. The pH is getting higher for the stomach acid, which interferes with the ability of proper digestion and assimilation right at the stomach level, and then moving and triggering those next steps in the small intestines. In the small intestines, it will feed on Pseudomonas, will feed on casein, the protein in dairy, gluten, and this will impact those brush borders in the small intestines, the enzymes, the transporters, and contribute to leaky gut. There's also evidence coming out that when Pseudomonas is elevated, elastase is low, Candida is high, and H. pylori. When you see H. pylori present or high, very likely that SIBO is present. So not diagnostic of it, but strong connection, something to consider. And that H. pylori and SIBO connection, we're seeing more and more of that research coming out. Okay, this is the 4th page for Team GI Map, again, quantitative. A little bit, some of the markers are the same as GI effects, but the ranges might be a little bit different. So you might want to compare that. It might be a more sensitive range or more narrow bandwidth for getting a flag. That is the case with elastase, steatocrit, and beta-glucuronidase. This test has anti-gliadin immunoglobulin A included. I like that. I like to see if there's an immune response to gliadin, typically found in gluten, but there's other grains that also have it. So I always consider the intestinal health incredibly helpful, and we can talk about beta-glucuronidase more. And then this is the last page. This is triggered if the H. pylori on page 2 is high enough. Then not only will it trigger virulence factors, but it will trigger testing for antibiotic resistant genes, which can be valuable information should a prescription be needed. Okay, let's look at the report for Team GIFX. So the first 3 pages are these visuals, and some will love them, some won't. So you know who you are. But here's how it can be helpful. Is they take it and divide certain markers into these pillars. And that top round part is sort of a graph of it. And the idea is that you'll see the red, focus there. The red is the bigger problem areas. The yellow, borderline green, not as big of an issue. And then those 5 pillars in that round little diagram there are the same pillars you see before. And these numbers from 0 to 10, you have a little key, but those numbers from 0 to 10 are supposed to help you as the practitioner decide, do I need to work on this? Do I need to focus on this? So in this example of the sample test, prebiotic, metabolic balance, looking fine, some borderline issues for maldigestion and some digestive support, but really some red flags for inflammation, microbiome, and antimicrobials. And then in that orange box, you see listed what's high, what's normal, some of the key markers, and then a few of the possible recommendations underneath. Now, again, just keep in mind, this is using this lab's algorithm. So you do need to also make sure that's in agreement with how you practice and what you see clinically. So that's page 1. Now, page 2, we're still in the visuals and their algorithms. And you can see this commensurate abundance. This is based on what they see, their history of running labs. Where does this patient fall relative to the rest of the labs they run? And same with the dysbiotic pattern. So that may or may not be helpful to you. You might love that, use it, spend a lot of time talking about it with patients. You might say, not my thing. I want to skip over it. You're going to have to explain to the patient why you're skipping over it and moving into the exact data section. Okay, one more page that falls in that category is page 3. So again, using their history of lab testing, where does that patient, this specific the specific stool sample fall for commensurate balance, and then looking at relative commensurate abundance. When they say healthy cohort, again, that's using their lab findings and comparing this specific test to that. Okay, so page 4, we start getting into the actual data. So now you start seeing the markers. You're going to see some of the same markers, Team GI map and Team GI effects. The ranges might be a little bit different and the testing method is different. So make sure you know and you're comfortable with your choices and your reasoning why. Some of the things to keep in mind on here, protein breakdown is included. I like that. If someone's protein breakdown is high, why do you care to know that? That can be an indication that they're fermenting more protein in the colon versus we want them fermenting fiber, right? When they ferment fiber, they're going to produce butyrate, and butyrate really, feeds the cells of the gut lining, very beneficial. Many of you might use butyrate supplements. But when the protein fermentation is getting high, there's probably a lack of fiber in their diet. They can be more pro-inflammatory. You might see low fecal bacterium, which is a keystone species for the gut and very important. You might see some low or high elastase or low or high calprotectin. And again, this could also tie into some of the more stubborn issues you're having, maybe even SIBO with protocols that aren't working as well. For the inflammation and immune markers, the ranges might be a little bit different, but calprotectin and Sig-A, fecal Sig-A, it's the same on both tests. And then GI effects includes eosinophil protein X. That marker is helpful because it shows if there's an IgE allergy. So this is eosinophilic infiltration versus calprotectin is neutrophils. This eosinophil protein X will be elevated with a lot of IgE allergies or parasites, could be elevated with parasites in the gut. So that's something to keep in mind because, your lab test might not pull up the parasites and you might have to look for other signs that they're there, especially if the patient presents with a lot of symptoms. And then the Sig-A, which is on both tests, Sig-A is your first line of defense in all your mucous membranes, so nose and throat and lungs and gut. So really mucosal surface, it's that initial immune response. It can indicate barrier issues. Also here, short chain fatty acids are included. So on GI effects, short chain fatty acids are included, and there's a breakdown of it. So that can be very helpful too, to sort of see the intestinal environment and whether there's a need for butyrate supplementation or more fiber. And then this gives you, this is the same page. It was long, it was hard to read. So I sort of broke it up and overlapped it. And you can see the commensal bacteria. This lab, Team GIFX, breaks it into phylum, whereas Team GI map breaks it down into commensal and opportunistic and potential autoimmune triggers. So that can also impact how you like your reports and how you want to read it. There's some Proteus species. You can see it in the Proteobacteria phylum, and those can be helpful to see. Interesting enough, each lab has some different ones. So it depends on what you're looking for. And I put some notes there about what's available and what's not. Here's the next page. At this point in GIFX, we're getting into culture. That's an older method for stool analysis. Some still like it and will argue that it helps to see something that's slow growing. And others will point to research that says, quantitative PCR is really replacing it. So it depends on what you're looking for. On GIFX, the Candida marker is via culture. And then under additional bacteria, there's a number of bacteria that they will test for. So on Team GI map, that shows up quantitative PCR. You see that automatically on every test. Team GIFX, you're going to see that if it shows up via culture, and how do you use that in your practice and the significance. And then you can see on the right, they actually do microscopy, which it really is an older version because it's, it's not very cost effective, which is probably why the price is higher. And it takes time. They're looking through a microscope. So some will argue, well, we're better able to catch and not miss, eggs and ova for the parasites. And then some will argue, again, research is showing that qPCR is more sensitive for picking up those parasites. So I've also known situations where a patient had so much going on that, we ordered 2 different stool tests for the same patient with the same sample just to make sure nothing was missed in any area. So these are some of the criteria you're going to use when you're selecting. Now we're getting to the last page for Team GIFX. And there's a few parasite organisms that they use traditional PCR on. So you can see those there. And then on the right, you'll see an example of some of the add-on testing you can choose to have. So it's not standard. There may be a time where you don't want it. You feel like it was already tested. And there may be times where you say, I want it, let's add it on. Okay, the final criteria for you to consider, Team GI Map versus Team GIFX. What matters to you? Criteria number 1, which one will you use and which one are you going to order? So whatever you're most comfortable with really matters. Criteria number 2, is the information helpful? Do you understand the testing methods and the markers? How does it connect and correlate to what you're doing with the patient in your practice? Criteria number 3, what is the ease of ordering, the cost, and the time? A lot of similarities there, but a few key differences that may or may not matter. So just make sure you understand that. Criteria number 4, practitioner support. They, both labs offer an abundance of practitioner support. Get familiar with it and see maybe you're more drawn to one or the other. What's your learning style? And criteria number 4, reading the report. You have to be comfortable with reading the report. Sometimes it's just repetition. Again, don't feel like you have to have everything memorized. You need to be able to find it. Okay, so what is the verdict? The bottom line is you can have your favorite. There's nothing wrong with that. You can say, I'm Team GI Map all the way, or I'm Team GIFX all the way. You can have your standard that you like to order, no problem. However, you need to be well versed in both of these labs. They're very popular. They're very common. Even if you have a favorite that you use in your practice, you're going to have patients come in and they saw someone else and they come in with that test, and you need to know how to review it. So be ready to use those resources. I also wanted to share where you can get more information. If this isn't familiar with you, familiar to you, this is from Rupa Health. So besides each of the lab companies having excellent education resources, Rupa Health does also. And you can see here, they're giving you some stats of different testing method and turnaround times, a link to see the markers, that's the analyte list for multiple GI stool tests. So they're a great resource when you're considering. All right, what are your questions? What's on your mind? And let's do some Q&A.
Thank you so much, Dr. Zachary. That was absolutely amazing. I think everybody learned a ton here today. So many practitioners run stool tests, and sometimes it can be so difficult to know exactly what's covered in each one. So you did an amazing job in really letting us know essentially on what's on these 2 tests today. So thanks for diving deep into this topic.
My pleasure.
So again, yeah, round of applause to you, Dr. Zachary. Now, we received a lot of questions during the presentation today. We're going to try to get to most of those now. So we have time for about 3 to 5. So I'm going to jump right into the first question with you. All right. And that is this is a practitioner asking a question, which is, we see Pseudomonas on certain tests. Why would you want to see Pseudomonas on a stool test? What is the benefit of that?
I like to see Pseudomonas. Everyone's going to have a different opinion. Pseudomonas isn't always pathological, but I like to see it because it's very abundant. You can find it in the soil. People who get hot tub folliculitis, which can be common, their hot tub gets out of balance. Pseudomonas is the most common bacteria. And if you're working with patients that have immune challenges, the longer that you do this, the more challenging patients you get, right? So if you get people that have immune issues, someone else who gets exposed to Pseudomonas, it could have maybe no impact on them. Someone with an immune challenge, it can become a very serious infection where they're needing antibiotics. So I like to see Pseudomonas for that reason. And then also because of some of that newer research that's tying these Pseudomonas levels in with SIBO. We see a lot of patients dealing with SIBO, and is it getting in the small intestines? So some of the emerging data is just a marker I like to be aware of.
Amazing. Thank you for that. Next question is, what do you do if you see Proteus elevated on a stool test?
So again, some say, well, there's many different types of this proteobacteria category or proteospecies. It might mean nothing and it might not, but each of the labs, GI-FX and GI-MAP, they have different Proteus markers that they show, and each of the Proteus has a different clinical significance. So for example, the one on GI map, when I see that, that's when I order the urinalysis for women, because if it's high and they have a UTI, certainly if they have symptoms, but even if they don't, if it's high enough, I just want to see if something's there and refer out as needed. Some of the Proteus markers on GI effects, there's one that's very common, and it's a type of SRB, sulfur reducing bacteria. And sometimes you can see that high when you're dealing with patients that have hydrogen sulfide overgrowth. So that is a newer marker we look for with SIBO. And it can be a painful experience. So it's one of those gases that when it's made can cause abdominal crampings. So pros and cons on each test, but Proteus as a whole, I just consider, part of it's the way it works with that flagella and its pattern in the body. I just consider it a bit more aggressive, particularly when it gets across the gut barrier and systemic in the blood supply. So depending on which test I'm looking at, it's going to inform a clinical decision and an action on my part.
Good to know. Good to know. Thank you for that, Dr. Zachary. Moving on to question number 3, which is, my patient has high protein fermentation. Why should I care about that? What is something that I could, or why should I look at that?
Okay, so protein fermentation shows on GI effects. And again, it's probably someone who has maybe a history of constipation. So you want to ask what their bowels are like, or if they're dealing with slow motility. But they could be fermenting protein more versus fermenting fiber in the colon. So not only does it impact their health right now in the moment and what their bowel function is, but it really impacts their long-term health, because we do know that we don't need a crazy amount of fiber, but Americans tend to be too low in fiber. So we need enough fiber to have a good stool, and having regular bowel movements, sufficient fiber decreases the risk of colon cancer. And colon cancer is certainly a problem that just continues to grow in Western society. So this can be an early sign of a problem that might come down the road. And in functional medicine, we always like to say, it can be a little anticlimactic because you're doing things now for something not to show up later, but that's really good practice, right? So if someone needs to change their diet, if they need to have a better stool, if they maybe need some butyrate supplementation, again, it's going to inform a clinical decision.
Absolutely. It's so much better to be proactive than reactive. So thank you for reiterating that, Dr. Zachary. On to the next question, which is, many patients reports come back with a numerous amount of elevated markers in different areas of either of these tests. So practitioner is asking, I have a patient that has high H. pylori, high Pseudomonas, as well as high Candida and other things. What does this mean? What is likely the case in the cause when we have high elevations in these various categories?
So it used to be that we just looked at sort of each one separately. But now we're starting to see that connection between H. pylori, Pseudomonas, Candida, and a higher propensity of SIBO, particularly if they have all three of those. That's that example of when Pseudomonas is more likely to be in the small intestines and can be feeding on the casein and the gluten. This is helpful to validate, patients might say, oh, I feel like, I just talked to a functional medicine practitioner. They tell me to get off dairy and gluten, and that's just standard. Well, this is part of why, right? So it's, again, can inform a clinical decision. Like you might want to order a SIBO breath test if you see that. If H. pylori gets high, I'm always thinking about the digestive capacity right at the stomach level. So it might impact bringing in a digestive aid and starting to just sort of educate the patient. And then as the practitioner noticing, like, how long is it taking this patient to digest? Do they have any gaps between their meals? Like, do they have enough gaps? Or are they constantly eating? If they're constantly eating, that's going to mess up their digestion. Nothing's going to work properly. But if they have enough of a gap, is it allowing the stomach acid to properly break down and assimilate, and to have the contents, the chyme that is formed, be acidic enough that as it is spoon-fed into the duodenum, the small intestines, it has to be very acidic to trigger the next response, the release of pancreatic enzymes and what we need to have happen in the small intestines. So H. pylori will have you be thinking of that. Pseudomonas, we're talking about all these different connections, but even Pseudomonas itself, if it's too high, at a minimum, could be a sign of dysbiosis or could potentially be a sign of a more serious infection. And then what was the third one? You said Candida. So Candida, there's over 600 yeasts, but about high 90s, maybe 97% of opportunistic yeast overgrowth is Candida, which is why you see that used interchangeably. Very common, especially if there's a bacterial overgrowth, to see a yeast overgrowth at the same time. And yeast, it duplicates rapidly and it can really go everywhere. So very helpful to know if yeast is present and what to do and when to do it, because not everyone is going to need or respond well to an aggressive like anti-candida protocol right from the beginning. Some of your patients, and why these stool tests are so valuable, some of these patients, you might actually do something palliative, and maybe you're going to bring in probiotics first, or butyrate, or do something, maybe some barrier support before you do a kill protocol. Another patient, it might be turned the other way around. So all these things help you get more specific and individualized with your protocols.
Very interesting. Thank you for that, Dr. Zachary. And you mentioned SIBO a couple times. So next question is about SIBO, and that is, can you diagnose SIBO from a stool test?
So technically, no, although the labs might say otherwise. And the reason they might say otherwise is because they're getting better and better at having markers and seeing these connections, that this marker or this set of markers is elevated when SIBO is present. So that is very valuable information. But still, the North American standard is to order a SIBO breath test. And I recommend the 3-hour lactulose tests, and you have a great version available through Rupa Health. We use it all the time. And then of course, tie that together, to the clinical practice. We did a webinar on SIBO before, so if someone wants to know more, they could go back and watch that, because that was pretty extensive. And we talked a lot about testing and sort of the art and science of reading that test, because those SIBO tests can be a bit more they have an objective and a subjective side to it. But again, when budget's not an issue and there's clinical indicators for multiple tests, the savvy practitioner is really able to tie a good stool test together with a SIBO breath test, with a Dutch or other hormone test, with a typical blood panel. And it's really fascinating to see how they are connected. And again, deliver more specific individualized care and protocols as a result.
Amazing. Thank you so much for that thorough answer, Dr. Zachary, to that question. So we have time for just one more question here today. Again, amazing job today, Dr. Zachary. So the last question is related to H. pylori. Now, we know that there's many markers on different stool tests that may be elevated, and some practitioners may choose to go after certain markers if maybe they're not super elevated, or they might be lower than normal. And so the question is, the practitioner has patients that sometimes has a H. pylori show up, but do you always go after H. pylori if present, even if it's in a lower quantity or a lower amount?
No, we don't always do something specific for it. It depends. If it's higher and it fits the clinical picture, and I'm seeing a lot of other markers, then yes, we will try to wrap that in. When you see all these markers and high and lows and borderline, you could give a specific supplement for each thing, but in real life, you don't want to do that. It would be too much. They would have to have like a suitcase to wheel around their supplements, right? So you're trying to find, one thing that's going to knock down a couple pens. So in that example, if H. pylori was high enough or significant enough, it fit the clinical picture, I felt like I had to go after it. And there are a couple other things. I'm going to look for some type of antimicrobial or some type of overall support in my plan that can bring these all together. And then if H. pylori is present, but I don't feel like it has to specifically be addressed, I'm going to pay attention to what's happening with their digestive capacity. And then if we retest down the road, does that value change? And just keep matching it to that clinical representation. So I might need to bring it in at some point if it were to increase or some symptoms were to show, or it might be that it's just present, they're a carrier. About half the population can be a carrier and it's not pathogenic. That's what research shows. I would also argue that's a sign of how many people are dealing with digestive issues, right? And so where on the retest does that marker show?
Amazing. Very, very true. Thank you so much, Dr. Zachary. So again, thank you so much for answering all those questions today. I know we weren't able to get to everyone's question, but please reach out to us after this live class if you still have questions or need help. So again, thank you so much for attending today's live class. I want to give a massive shout out to Dr. Brandy Zachary. It was a pleasure having you back. This was very, very interesting and helpful in understanding the differences between these two stool tests today. So we hope to see you all at the next live class. Now, before you leave, we have our head of practitioner partnerships, Adrian Martinez, who is going to put on a live demo right now for all of you. So if you'd like to learn more, please stick around. And Adrian, I'm going to pass it off here to you right now. So thank you again for attending today's live class.
Awesome. Thanks, everyone.
Anthony, and appreciate you as well. Just one more quick shout out to Dr. Zachary. That was amazing. And want to give a quick plug. If you are interested and you're located in the San Francisco Bay Area, Dr. Zachary is going to come give a live in-person presentation for us regarding advanced health or gut health, October 19th. It's a Tuesday. We'll send out more information regarding that. But we really hope to see you there. And we're super excited to, again, be working with her on another event. So with that, great to have you all here today. My name is Adrian Martinez. I am the head of practitioner partnerships at Rupa Health. Would love to run through a quick demo with you all. You came to this presentation today, sponsored by Rupa Health. want to talk about who we are, what we do, why we're doing what we're doing. So a quick agenda. I'll go through who we are, again, what we do, why we're here. And then from there, I'll walk through what our product looks like. I'll go through what the experience will look like for both the patients as well as for the practitioners. So with that, I'm just going to share my screen so you can all see. So speaking to what Rupa Health is, if any of you have ordered lab tests before, you're probably familiar with the pain points that are associated with it. Most practitioners work with anywhere from 3 to 6 labs at any given time, right? Each lab might have a specific specialty that they're focused on. So you'll need an account for each individual one. What that generally means is having to go to each individual portal to order your tests. I mean, I speak with practitioners on a daily basis who work with 10, 15 labs, right? So it can be a lot to manage. So what we've done to alleviate that pain point is we've brought on 20 plus different labs onto our platform, allowing you as a practitioner to place your orders all in one place, right? So as opposed to having to traditionally go to each individual portal to do that, now you can come to Rupa Health, order from any of these lab or order from any of these 2,000 tests, as well as track the progress, status, and view your results all within Rupa. So really streamlined, very simple. The second component to Rupa Health that we've built out is the patient experience, right? So again, with these tests, there tends to be quite a bit of handholding involved. So who on your staff is managing that handholding, all the questions that are coming through, the specimen issues, right? The support that can sometimes just be involved with these tests can take a lot of time. So what we've done is we've built out an end-to-end patient experience. Once you place these orders on Rupa Health, we can effectively take it from there. We can help manage billing. We provide multiple different billing options. We'll send over FAQs and instructions. If there's a phlebotomy required, we can coordinate that directly with the patient. But the big idea here is once you place that order on Rupa, your patient has one single place to come to with any questions that they have, and we'll take all that admin work off your shoulders and onto ours. So what does it look like? What I'm going to first show you is how simple it is to place an order on Rupa Health. So on the top right of both your dashboard, which you'll see here shortly, as well as within the catalog here, you just start an order. To place an order on Rupa Health is as simple as knowing your patient's first name, last name, and email address. We collect everything else directly from the patient. And we do this for a couple of reasons. Number one is to streamline things for you to be able to simply place orders on our site. Number two is to ensure the accuracy of the information that you are putting through with the order, right? Patients can move addresses, their information can change, right? So we'll collect that directly from the patient to ensure the accuracy there. So what you're seeing here is the order screen. The first sets of tests that you'll see up at the top is custom bundles. So at Rupa, we can create custom bundles, and a bundle will be a set of tests. It could be a set of blood panels. It can be a combo of blood panels and tests, whatever you want it to be from a variety or really any of the labs that we're partnered with. So the idea being one click and all the tests that you're looking to add in a bundle will be added into your cart without having to search through the entire catalog to do so. Below that, we have a favorites list. So a test that you're most commonly using, you can actually go ahead and add a heart next to it. So it'll be among the first tests that you see when you're ready to place your order. So again, you don't have to search through the entire catalog to find tests from various different labs. To keep things on brand for today's conversation, let's go ahead and just quickly order GI maps and GI effects from each of the different labs, from Diagnostic Solutions and Genova. So right there, it shows you how easy it is to order from any of the labs that we're working with. I know that Dr. Zachary earlier talked about the add-ons. And so to add on a test, it's as simple as going onto the right-hand side. You click on that test where the add-on's available. And here's my zonulin add-on. From there, that's how easy it is to not only order the test, but add that add-on. If you're looking for a test that might be outside of the scope of your bundles or your favorites tests, down below, you of course have access to any one of our 2,000 plus tests. So it really is that streamlined and that simple to place an order on Rupa Health. Our test will go ahead and default to be drop shipped directly to the patients, but we do work with a few labs that offer the opportunity for those kits to be sent directly to you. Most of our practitioners will prefer to have the kits drop shipped to their patients for various reasons, but one of them being you don't have to stock a bunch of inventory in your offices anymore. It's as simple as getting it sent directly to the patient. We'll collect that shipping information from the patient. If you do prefer to have things drop shipped to you in your office, we have that option here. You just simply toggle that on. Each order will go ahead and default to being invoicing the patient directly. I would say the heavy majority of our practitioners prefer this for the simple fact of they don't have to deal with billing anymore, right? But if you do decide to pay for the tests, you do have that option here. You simply click this box, you'll enter in your payment information. From there, it'll bill your card, and then you can manage billing with the patient separately outside of it. So an example reasons why that might be an option is if you're working for, let's say, like an 8-week program, and you want to just bake the cost of those tests inside of that one cost, you have that option with this here. You can add notes for the patient. For example, if you want the patient to continue be taking supplements during their testing period, you can add that note for the patient there. We'll go ahead and send that directly to the patient. You can add notes for Rupa, and this can be anything. An example for this would be if you prefer to have your results faxed to you, you can enter that information in there, and we'll go ahead and fax you the results once they're in. And then ICD-10 codes. We have the option, of course, your patients have the option of submitting a super bill to insurance after the fact, right, for reimbursement. And if you're interested in that, you can hop in here, and we have a whole catalog of ICD-10 codes. And what that do is you pull up just a keyword, and you have the whole list of the ICD-10 codes that you're looking for. You don't even need to know that ICD-10 code off the top of your head. From there, it's as simple as clicking send to patient. And that's how you place an order on Rupa Health. So with that, let's talk about how our pricing works. We have negotiated wholesale practitioner rates with all of our labs. And what that means is the same prices that you are looking for, that you would get going directly to the labs, will be the same prices reflected here at Rupa. The way that we generate our revenue is there's a flat 7% processing and ordering fee on each order. So let's break that down. What that means is Rupa Health is a free account to sign up for, free to hop on. And if you're having us invoice the patient directly, meaning you're not paying for the test yourself, you're having the patient pay for the labs, then the patients will be the one absorbing that processing and ordering fee. So what that means for you is that Rupa is a completely free account. You're never going to be charged anything by Rupa unless you decide to pay for the tests yourself. Now, let's break it down for the patient. Let's say that the patient is ordering these tests. Most labs offer both a patient price as well as a practitioner price. Because we offer that lowest practitioner price, your patient is more likely than not going to be saving a good amount of money, right? As opposed to them being referred directly to the lab. So most tests tend to be tens, if not hundreds of dollars more expensive, depending on the lab or the test that you're ordering. So we always want to offer them that lowest possible price. And that's how you place an order, and that's how our pricing works on Rupa Health. Now, what I'm going to jump in and show you now is how we track those orders. So within the main dashboard here is where you're tracking all of your orders within Rupa. So we can hop down here. I can search by specific patient. I can filter by status of my order. Now we'll always update the status of all your orders in Rupa Health, and then all your orders will be displayed down below as well. I can click into an order at any time and get an update as to where that order stands. So as you can see here, clicking into an order, this is 4 separate tests, and I have an indication and an update on all of them. Now, this, of course, is my demo account, so you can see the dates are a bit in the past. But looking at this, right, I can see that the sample arrived on June 1st, and I can get an estimation of when those results will be coming in. You're alerted as the results come in via email, and you're able to, again, view all your results within Rupa Health, as opposed to having to go to each individual portal to do so. So as you can see, I can download the results. I can send the results to the patient. We'll never send the results directly to the patient without your consent. So you do have that option within here. You can request a clinical consult. I know Dr. Zachary touched on this earlier, especially for newer practitioners who have questions and you want to have some assistance interpreting the results. You're actually able to do that directly through Rupa. So once your results are in, you can schedule a clinical consult with that lab and get that assistance that you're looking for to help answer those questions regarding the results that you're receiving. And then, of course, you have the option of viewing the requisition. From there, there's some other cool features, just I'll highlight real quick. You can mark this test as reviewed. So once you review it with the patient, you can mark it as reviewed. And you have the option of actually ordering this again, or even scheduling an order out in advance for the patient. So if you're looking to maybe retest within 6 months or 6 months from now, you can go ahead and schedule that order 6 months out. And that way it's basically an automated process. So you don't have to necessarily mark it down in your calendar every time. You can do that all through Rupa Health. And that's how you track your orders. Now, I'm going to run down this left side here before showing what the patient experience looks like. We already took a look at the lab test catalog when we first got in, but Rupa University, you're all should be very familiar with this as we're currently in Rupa University. Rupa University is an amazing catalog and resource that we're going to be hosting live classes. So you can hop in here, you can see our live class that's currently happening, all of our upcoming classes, and then any class library, any recorded or previous class that we've hosted will be recorded and uploaded into this catalog here. Now, of course, we offer support. We have both practitioner support as well as patient support. So if you have any questions at any point, we have this messages portal right here. It's completely HIPAA compliant, and you can reach out directly to our team. Now, let's say that you are in a clinic. We can actually set up as a clinic as well. So the way that we would do this is you create one account, and we can invite team members. We can invite whether it's other practitioners, maybe a physician assistant. You can invite them to this account so everybody can have their own separate login, but be able to view the same information, operate as one cohesive unit. Last couple of things I want to shout out here is turnaround times. So we are acting essentially as a third party to help your business run more efficient and effectively, right? The labs are still the ones who are shipping out all the tests. And with that, of course, are going to be varying turnaround times and result times, but we try to make that as transparent as possible. So you have full visibility into what specific turnaround times may be for each lab. But that said, should there be any delays, you'll be notified. So as you can see up at the top here, Great Plains results are having a delay. Mycotoxins experience 6 to 8 week processing time for results. So you'll be notified here. We're actually building out a more detailed alert system as well. So should this test be impacting you and your patient, you'll get a separate notification regarding that as well. So really cool, really unique regarding that. So that is the main dashboard that I'm going to show you for today. The next thing I really just want to show you is just what the patient experience is. This is, in my opinion, the second and most important part about Rupa is how are we helping your patients out? How are we helping improve those compliance rates, right? And what we found is that our compliance rates right now at Rupa are 85%. So that's huge. Here's a timeline of what your patient will experience through Rupa. As soon as you place that order, they'll get an email notification from us. The kits will be shipped out within 24 hours of payment. So if you want to point out one thing that may be different about Rupa than maybe direct labs is that we wait for payment to come through before we ship things out. Once the kits have been shipped out, we'll send over FAQs and instructions directly to the patient. We'll check in with the patient, right? So again, another thing that I think is very important, or rather that is very important, is follow-up with patient, right? We automate this follow-up, so you don't necessarily have to. But of course, if you want that personal touch, more than welcome. And then of course, you're notified as the results come in. So what do those communications look like? Let's jump into that. So your patient will receive a notification as soon as you place that order, as I mentioned before. And here's what it will look like if we're the ones invoicing the patient directly. Hi, Joshua, Dr. Jordan has ordered these tests for you. We'll introduce who we are. And then from there, we'll actually show and highlight the different payment options that we accept. So as opposed to just traditional cash pay, which a lot of these labs tend to be, we can do not only cash or credit, but we can actually do HSA, FSA, as well as setting up a 3-month interest-free payment plan directly with the patient. One of the big ideas here behind Rupa is we want to make root cause medicine the standard. We want to make it as accessible as possible. And these different payment options is one of the ways that we do that. From there, we'll collect all the necessary information to complete the order, demographic information, shipping information, billing information, of course, and then we'll highlight the different tests that were ordered for that patient. They do have the option of delaying the order or canceling the order. For example, they can delay it 1 week, 2 week, 1 month, and then we'll notify them as that time elapses. The alternative being them canceling the order entirely. If they do cancel the order, they do have to write in a reason as to why they canceled that order, and you'll be notified once they input that reason. The alternative option would be, of course, for you to pay for the order and then bill the patient separately, right? Should you decide to pay for the order, we'll go ahead and notify the patient, of course, but we're essentially collecting shipping and demographic information in that case. We're not going to highlight the cost of that test. That's completely up to you, but we do want to still manage that entire patient experience. Once those kits are shipped out, we'll notify the patient. And then a few days after that, they'll get an email that looks something similar to this. So on the left-hand side, you can see what the email might look like. We'll include the instructions, we'll include a requisition or how to fill out the requisition. And if there's a blood draw required, we'll send over options to the patient. Those options are based off what lab that they're working with. But should the patient have any questions along their entire process, whether it be related to the test itself, how do I take the test, or, hey, I can't work with these options that you sent over for my blood draw, they'll reach out to us and our team will coordinate everything and help answer all their questions. Again, the idea here is to remove that off your shoulders and onto ours. On the right-hand side, you can see an example of our instructions that we've curated ourselves. Very user-friendly, but also extremely comprehensive. This will break down, what the phlebotomy options will look like, that process. We can add a custom phlebotomist as well. So if you have a blood draw location that you want your patients to come see, or maybe you even yourself have a phlebotomist in office, we can take that information, have that sent to the patient directly. We'll walk them through the requisition process. And of course, that varies based on the lab, right? So there does tend to be a number of questions regarding the requisition. So we'll manage that. And then from there, we'll check in with the patient to see how everything's going. Again, another process that is generally handled by staff and can lead to low compliance rates. We want to manage and automate that process for you, right? Increase those compliance rates. And then lastly, of course, you're notified via email as those results come in. And so you don't have to go to each individual portal to view all your results from now. You can come to Rupa Health and you'll get everything all in one place. So with that, I'm going to drop my contact information in the chat. It's just Adrian@rupahealth.com, ADRIAN@rupahealth.com. And with that, I appreciate you all coming today and super excited to hear from you and be working with you. I know that we had a number of signups during this class, so super excited, and you'll be hearing from me soon.